What I expected personally was to find that it might have been people that found it very difficult to get to the pharmacy in the community or the GP practice. So I was expecting perhaps those who had mobility problems or access to transport. But actually that wasn't the case at all. We did have one or two that found it more convenient from the mobility point of view. But the vast majority were actually quite mobile and young, and they'd had several letters and contacts via texts and phones to get the flu vaccination, and they hadn't attended. And the reason for that was they are busy, they're young, they have young families, and they don't necessarily see the importance of looking after themselves. The first thing we had to do is to ensure that we had people in our clinic who were trained to give the vaccination, and also we had the vaccine present, which means you need access to a fridge, and also that we had consent forms that we could share between ourselves and primary care. And then it was just a matter of identifying those who hadn't had the vaccination by asking them and offering it with an explanation as to why it was important. It isn't as simple as it might seem. The systems are quite complex. For example, you have to order the vaccination in quite early on in the year. So the pharmacies, when they've ordered vaccinations in the hospital, have often ordered those for a pre-existing population such as the staff. So you've got to order for the clinics quite early. There's also some concern that we might jeopardise GPs who need to provide vaccination with regard to their income and pharmacy. But actually what we found is that number was actually very small, and we were definitely targeting people that were just not turning up rather than those that would, traditionally go to their GP practice anyway. It is. The secret is breaking down barriers and letting everybody to, believe that they can do, rather than see the barriers, take them away and show that we can actually all work together.